Hello, I'm Maria Hall-Brown. Welcome to Protest and Promise. Well, there are lots of things to be worried about these days, in particular COVID. COVID-19 continues to be a problem and a little bit of a controversial one at that when it comes to being safe regarding masks. So we're delighted today to be joined by Joanne O'Brien, who is the administrator for LA's Medical Services, and she's going to be our expert in all things COVID related. And I'm delighted that we are joined once again by a terrific panel of young people, including Alondra. Hi. Chris. We welcome Bridget. Welcome back, River. And Richard. All right, this is your opportunity, all of you, to ask anything you want to know about the issue of masks, the issue of COVID, how it's being transmitted, things that we're learning about it, and really to tell us how it's impacting your lives, because needless to say, every single one of you, even before we began, told me some stories that I think are rather compelling. So let's go ahead and, as far as I'm concerned, let's talk with River first. River, in regards to COVID, how has it impacted your life?
Well, like everyone, COVID has definitely made me stay home a lot more, and it's definitely led to increase in things such as reading and TV. But one of the biggest things lately has been I am currently in Massachusetts on the other side of the country from LA because the rates were just so high, and it was an excuse to go see family on this side of the country. But as we were kind of talking about a little bit before the show, it was definitely a process going through the airport, getting to the other side of the country with so many regulations in place and that constant fear of, is the person next to me going to be tested? Do they have COVID? And is this going to potentially spread to me, my friends, and family?
And did you see a disparity in how people were treating it as you were traveling across the country?
Absolutely. Well, there were definitely people who had their masks on, who were being really careful, putting hand sanitizer on. Then there were also the people who were walking through the airport without a mask. In fact, when I was transferring flights from Denver, there was this big altercation on the flight where a woman just wasn't wearing her mask and she started screaming at people. And it was just yeah, as people would call it, a Karen incident. But yeah. So you can definitely tell the difference between people who see a concern and people who don't.
Okay, actually, that's a great transition, and I'm going to ask you, a Karen incident. We are all now, we understand what that meant immediately because of, the response people have had to whether they want to do things or want to not do things. But what is the need for masks? Why is it so important?
We know that the COVID-19 is spread through aerosols, and now there's even some discussion with the World Health Organization and many scientists you may have been reading saying that this is airborne. So the difference between sort of what we thought before, that when you talk, it's spread through just talking, through sort of little droplets of your spit that comes out. I know that's the only way I can explain it. It comes out of your nose and your mouth. So now we know that, are we thinking that it's airborne? So it can hang out in the air for a lot longer. And I have heard anything from hours to now days. So I think the scientists are still studying that, but the end result is this is highly infectious and it's easily transmitted from one person to another just by simply talking. So if you add a sneeze or a cough to that, it increases your chances of picking up that virus by a lot. If you just simply wear a face covering, it just takes that down to next to nothing. If you get online and just say, go to images, show me what that looks like with and without a mask. And the New England Journal of Medicine has a video up and you can look at that, and it's remarkable. And I encourage anyone to look at that, and someone who questions wearing a mask. And the thing about wearing a mask is you could be contagious and not know it. We know that there's this pre-symptomatic phase where you're getting sick, but you don't know it, and it's 2 days beforehand. And we also know there's individuals out there that do have COVID, they are positive, but they have no symptoms. So it's really important to take care of each other more than anything. You know, I understand people feel that it's a personal right to not wear a mask, but when you choose not to wear a mask, you might be endangering someone else. Mm-hmm. And there's people out there that may have somebody at home that can't fight infection. You know, they may have cancer or AIDS or even cardiac disease, diabetes, and they could carry that home to those people. So, or they themselves might be ill, they just don't look ill. So it's really, really, really important to stop the spread by simply wearing a face covering and keep that distance from other people. And they're easy things to do. So.
Do any of you know people who are having a hard time with the whole idea of wearing a mask? I mean, is that something, because, you know, there is a lot out there right now that says your generation and the generations around your generation are feeling resistant to doing that. Do you know anybody that doesn't want to wear it because they feel their civil liberties are being threatened? Everyone you know is wearing masks.
I mean, I know people who who are older, who have sort of like claustrophobia, and so they're like, it's more on that side of thing. Like if they're not inside, and if they're not, like obviously, if you're walking around in a very crowded outside area, or if you're inside, they'll wear the masks and they don't like it, but they'll do it. But they don't really see the point of, say, you know, when you're walking around your neighborhood and nobody really is around, wearing a mask. And I think that's generally what the CDC has said, right? Like if there's nobody around and you're just kind of exercising or something, there's really not a whole lot of need for it.
Yeah, you're right. And this is where the judgment comes into place. Like when I'm walking around my neighborhood, I have my mask handy. And if I see somebody coming my way as I'm walking, I'll put it on out of courtesy for that other person. But it is really difficult to exercise and wear a mask. And you're right, there are people who feel claustrophobic, and it is difficult. I understand that. But I think big picture, if you're going out, you know, try to find a mask that's comfortable and absolutely wear it. It's just for a short time.
What about the whole idea of the fact that COVID doesn't necessarily harm or attack or hurt young people? Are you hearing that from any of your friends? Does anybody think, oh, well, you know, it's not a big deal, I'm not going to get it, and even if I do, it's not going to be, you know, a problem? Has anyone heard that amongst your peers? Sort of, Chris?
I've definitely heard it.
Yeah, Chris, what have you heard?
I've heard a lot of my friends say, like, I'm going out tonight, or I'm going to this party tonight because the COVID won't affect us, or because we're too young, or our immune systems and such. But I think even if that's the case, like what's brought up earlier, you can still give it to someone else, even if you're asymptomatic.
Have you said anything to them when they say that to you, or are you just going to?
Of course, I tell them to don't go, or I tell them put on a mask, or if you're gonna go, make sure it's not a lot of people, because if you come around me and I get sick, because I have underlying health conditions.
Oh,
so
man,
if I get sick, then I'm gonna get really sick, and that's not gonna help the whole situation. So I kind of tell them, don't go anywhere, and if you do go anywhere, don't come back. Like even when my mom has to go to the store, like I sit in the car and like she goes with her mask or whatever. So
you're,
you know, it's kind of
smart.
like we're making the precautions.
Yeah.
What about that whole thing? How is it? Because we're learning about, as you've told me before, it's a novel virus. It's new. We're learning. So what have we learned? Because it is affecting people of our wonderful panel's age bracket in ways that we didn't expect.
Right. Well, the people that are younger, as you described, are going out. I'm not going to get that sick. Maybe not understanding they can make other people sick. And what we are seeing is when the younger folks are picking up this infection, they are not getting as sick. They may be hospitalized, which you have to keep in mind as well, that at least in LA, the hospital system is starting to get impacted, which is a very big deal because there's still regular stuff going on in addition to this. You know, people have car accidents, they break their legs, you know, they have a heart attack, and so access to care will be very difficult. So it's really, really important for people to take that personal responsibility. And I think this is going to be with us for a while, so you have to look at how are you going to do things maybe differently You know, it is important to see your friends, but maybe figure out a way to see them safely. Go meet at the park and sit in a chair way far away from each other and catch up. There are ways to socialize. You just have to sort of think out of the box and how can I do it differently? You know, I have a 14-year-old grandson, and, you know, he completely got put out on a timeout in March, has only seen his friends once, but we went to the park and he got to see his friends. It worked out very well, you know, and he was as happy as can be. But he Zooms his friends every day, so he's still socializing. He's just doing it differently.
Yeah. Bridget, do you know anybody that's actually been affected by the virus?
Yes, I have two sisters that tested positive for COVID-19, and I have like this whole extended family that ended up affected.
How did that affect your family? I mean, is it scary? How was it? I mean, hopefully your sisters are okay, correct?
Oh yeah, they're fine. Yeah, they're both fine. Well, one of them was a lot more serious than the other. Like the younger one only had like very little symptoms, like no taste or smell, and the other one was the one suffering with like sinus issues and stuff. But like other than that, like other than like them quarantining for longer than they were supposed to, that's basically the only way that they were really affected, or that I was really affected.
Did it make it real for you though? Did it kind of give you a different perspective than just hearing about it and reading about it?
Yeah, definitely. Like I was a lot more stressed out than like other people that I saw on social media, just like not taking it serious.
Right. Did your sister did her taste and her smell return?
Yes, it came back very slowly, like with like salty or like spicy food, and then it just all came back.
Right. That's one of the things about this, and you know, at first it was just the dry cough, and then it was you know, the lung issues, et cetera, and the fever and everything. But as time progresses, there are these odd symptoms, and smell and taste was one of the, you know, early ones. But now there are even more.
It varies from person to person, but it can start out with a backache. It doesn't necessarily mean that you're going to get a fever. You could have this dry cough, which is very unique to the COVID-19. You can also have diarrhea. It can cause nausea. You can get a rash. You can also get, I don't know if you've seen on the news, the COVID toes, where you get these like bright red toes that are kind of swollen and they hurt and they're red. We know that in some people that have been hospitalized, it can affect all of your organs with sort of this inflammatory response. So it can affect your heart, as well as your lungs and your kidneys, and so everything can kind of shut down. So there's this just array of people that have these very slight symptoms to very severe, to where they're hospitalized and on a ventilator. And those individuals that end up on a ventilator are on for a long time. It's not just like a day or two. They're on a ventilator for weeks. And then afterwards, when they're able to get off the ventilator, they're not quite healthy for a long, long time. And some of them are having some trouble thinking, some cognitive issues. They're not the same. So it's very new, as you said. We're still studying it. We don't know if this is going to be something that person is going to have long term, or it's just going to, when the person gets better and they recuperates, all that'll go away. We just don't know. It's too early. But the end result is this can be really, really, really serious. And you don't know if you're going to be that one person, because there are young people that have ended up on a ventilator. You know, we've all seen those on the news. So it's not 100% because you're young, you're going to be okay.
Alondra, what are some of your concerns? Because I know that you have some plans for the fall in terms of student teaching, et cetera. Are you worried about being in an environment with a large group, or are you, I mean, do you think about this? Is this part of your world?
Yeah, it's been giving me anxiety for the past few days. I've been telling my mom that I just can't, like, sometimes I can't put my feelings into words anymore. I get really anxious because both me and my dad are immunocompromised. And I, first of all, didn't even get to have a graduation. I was first generation. And so I'm starting to get my piece with that. And now my dream job was working in a nonprofit with City Year, where I'm actually working for like a good few years. And that's working in classrooms to help students in low-income areas graduate high school. Like I've said before in other segments, that's really what I like doing. And so now it's that fear of, I do want to go to work and I do want to help and I want to make an impact, but I'm also fearing for my life. Like what if schools do open up and I do have to be in a classroom of 30 students. So they're saying that they might do hybrid, but still it's 15 students in one classroom. And then who's going to clean those classrooms after? And then also my mom works at a school as well. She does work front desk, but it's still that anxiety of, am I going to risk my life to go to work? I don't kind of have a choice. I don't know. Like I feel really nervous and stressed about the situation moving forward. Yeah.
That's a good point. You're bringing up a point. It's not just the physical issues that this whole thing has brought up. Has this been stressful for any of you? Has this become an emotional experience as well as a physical experience? I know Bridget said. Yeah, Chris, how do you feel about it?
This has been, well, to kind of give you like a short little why this has been really emotional for me is because before I was supposed to graduate, I went through like a huge thing where like I was doing really bad, and then I got it together, got my life together. I was looking forward to graduate my senior year so I could, you know, like say I did it. And then I got to senior year and it was like, okay, COVID, and I thought we were gonna only be out for spring break, and then we didn't come back. So that part right there was really emotional. But on top of that, when I'm trying to do things with my life, whether that be internships, jobs, just trying to get my college stuff on track and make sure everything's okay, it's hard for me because I don't even know. It's not even just me, but even, you know, businesses and places, this is new to them as well. So they don't even know how to work this whole situation. So I'm just lost and they're lost too. So it's really hard.
You know, I'm going to ask you something along those lines. As far as impact, are we seeing disparities in terms of what populations are getting COVID and what areas are testing positive that seem disproportionate in terms of place and race and
absolutely. We are seeing disproportionate numbers of people of color being affected by COVID. And as I said earlier, we don't know for sure, but some things that we have identified are people of color were essential workers, so they were out there working. You know, they didn't have the ability by the nature of their job to stay home and telecommute. You know, they were at the grocery stores, those kinds of things. They were in the healthcare setting. So they didn't have the option of staying home, having groceries delivered. There's also sort of it sort of highlights the disproportionate access to healthcare. It's not the same for everyone. So I think it kind of highlighted some of the challenges that we have in healthcare. Also, access to testing. There are areas in which people don't have access to transportation. So I know the city of LA has brought the testing out to those areas, but that's not everywhere. So globally, that they're kind of seeing this, but especially in the United States. So absolutely, absolutely. Yeah.
Has that been something that you have been aware of, all of you? Richard? Something you've thought about, something you've been aware of?
Yeah, no, definitely. And especially like I have a lot of family on the East Coast, and my uncle had it, and thankfully nobody else got it. But yeah, like New York City, especially in the Bronx, in Queens, you know, my girlfriend's family is from an Orthodox Jewish community. So like I heard that community was particularly hard hit, I think in Queens a while back. And I think a lot of it's also due to, you know, multi-generational households and a lot of families that are, you know, very close together. And, you know, especially with lockdown, everybody's kind of in the same area, so to speak. So if one person gets it, then everybody in the house gets it, kind of a thing.
You're absolutely right. Yeah, the multi-generational houses, and especially if there's someone that's an essential worker and they're going out into the world, then they bring that in, and it's just you can't isolate in those crowded conditions. You're right.
What are some of the weird myths you've heard about COVID-19, or some of the things that you you're all very intelligent, you're all very aware, and you're all very, keep yourself highly educated. But, there are some pretty weird myths going on out there. What have you heard that you just, raises an eyebrow? River?
Well, there's a couple of just statistical anomalies that are ending up not being correct. Originally there was this statistic that 38% of people weren't going to drink Corona beer because they thought it was going to be coronavirus, when in reality, Snopes just said, no, 38% of people don't like Corona beer. Or there's other things where it's people were using Tito's vodka to wash their hands instead of hand sanitizers, so they had to issue a statement. But what I find the most horrifying of all these rumors is when we have our president saying, hey, go use these chemicals to get rid of COVID, which are actually fatal. And there were a couple of reports of people listening to our president, taking whatever chemicals he suggested. I'm not saying specific ones because there's been numerous ones that he's stated, and these people have died. So it's kind of fearful that when we have a world leader, and a large world leader, the US is not a third world country. It is one of the top 2 countries economically and in terms of power. So when we see our world leader literally saying, do this dangerous thing that is going to take a life, that's concerning to me, especially when there's better alternatives.
All right, so information sources. You bring up a good point. Where do you get your information? Who do you listen to and why? Bridget, who do you listen to and where do you get your information?
I get most of my information from CNN or Now This, or basically anything that I know isn't biased, like Fox News.
Yeah.
Maybe it's a lot of don't trust an article you saw in a tweet that one time, or don't trust everything. I always like to do my own research as well, look up headlines and articles and stuff like that.
Got it. Chris, where do you get your information?
I get my information from, kind of going off what Bridget said, articles, news outlets such as CNN. But mainly, I kind of tend to get my information from my mom because she's in the field, but she's very close to what's happening. She works for a DV shelter, and so she deals with a lot of clients and hears about what's going on. So she tells me kind of how it works. And my mom bought 1 trillion packs of Lysol, and it's we're going to run help out the whole house and wipe the whole house down. So I listen to a lot. I try my best to not go by word of mouth or not just go by news channels, because sometimes they can be biased. So I think articles, and yeah.
That, does it bother you being an expert in the field and seeing things firsthand when you're seeing things, whether it be in a random place, just a tweet or a post of some kind, and also things that you see on the news? Do you ever just want to shake your hands?
Oh my gosh, yes. Because misinformation, I think, has helped the spread of this, because people might read something, see something, or listen to their neighbor and then not take the appropriate steps to prevent the spread, and then we're all affected. So I absolutely cringe, and always my go-to sites are the World Health Organization, the Center for Disease Control. Go to Johns Hopkins, go to universities that are actually doing the research, and it's right online, it's free, and you can get up-to-date information. So I think with so much misinformation going around, it's really good to just take that extra step and read yourself, because it is out there. Absolutely authentic, real studies that are happening.
Yeah, I think one of the things that kind of shocked me, and I usually don't inject here, but I'm going to just say that, you don't wear a mask because we've already been gifted with this wonderful breathing operation that will filter everything out.
Yes,
and, so just sort of separating thought, fact, faith, et cetera, is kind of a tough thing right now.
It is, and just listen to the scientists. That's what they do. You know, in this country, we have just so many wonderful, talented scientists and great world-renowned universities, and listen to them. They are on it, and they're right.
Richard, I hadn't actually asked you. I know that you were planning on going to school in the fall, but on a personal note, have you had any kind of direct relationship with COVID? Anyone you know, anyone in your world, anything that, you know, really affected you personally?
I mean, yeah, my uncle in New Jersey, he works in Manhattan, so he caught it. Thankfully, you know, he lives with my aunt and 3 of my cousins, and none of them got it, thankfully. My grandmother didn't get it, so everything on that front was okay. I mean, he gets the flu oftentimes, and I know it's not a valid comparison. It's more like pneumonia, which I've had, but like, yeah, he was just in bed for a couple weeks. So just like he gets every couple of years, thankfully.
If school does
but
go
he's
back,
pretty healthy.
If school does open up in the fall, are you worried about going back east?
Not really. I think the one thing I am probably more concerned about is just, you know, how my quality of education is going to be affected, because my school's already announced that they're going to be doing at least some of the classes online. They'll offer, as they said, as many in-person courses as they can, but realistically, it might even be all online. And they want to stop in-person instruction by Thanksgiving. I guess they're anticipating an uptick around wintertime. But yeah, I guess we'll just have to find out on that. But we're paying the same cost of tuition regardless. And I know every other school's doing the same thing.
That's kind of a universal theme with all of you. I mean, the way schools are behaving, acting, making decisions I think has truly impacted absolutely all of you. Am I correct in that? Did you ever think, well, obviously not, that's a silly question. All right, let's talk about modalities of treatment. You know, River brought up all of the not so scientifically based modalities of treatment. So where are we with treatment?
Well, treatment, it's the novel coronavirus, which means new. So we really don't have a treatment right now, and we have no immunity. So those are the 2 very important things to remember. This is new to us as well. No one has immunity to this virus, and that's why we're seeing so many cases. There are some antiviral drugs out that show promise. When somebody is really, really sick, they're trying the drug, and it's showing some success. So we are sort of seeing the death rates kind of go down or just kind of plateau. So we've kind of learned about it. We also have learned about the plasma, and that's where people who have been infected with the virus and they've recovered, they can donate their antibodies, and an antibody is something your body makes that recognizes something foreign and can attack it so you don't get sick. So that seems like a really good treatment modality. I also read about there's a company that's making a synthetic antibody, and it's in phase 3, which means it's sort of in the last phases. So there are some promising treatments out there. There's also an old school steroid that they're administering to people who are starting to get really sick, and it's showing some success in terms of treating, you know, the really bad sequelae that happened from this infection. So there is hope out there, but, you know, in terms of a vaccine, I think it's a long way out. You know, it's still in the trial phases, and until which time there's a vaccine, I think our world's going to look like this.
In terms of antibodies, are we still at that point where you're not sure whether if you've had it, whether you're immune to having it again?
What they're showing, the early studies is if you've had COVID, you had a positive test, and that they test for antibodies, and you have those antibodies, they're looking at about an 8-week window of immunity. They're not seeing the, like, I've got this, I'm never getting it again, you know, sort of like, you know, like the measles or something. If you've had it, or the mumps, you're not going to get it again. So I think that's part of the challenges with this. We're still learning. And that's why I think it's a little frustrating for people as well, because the information keeps changing, and it's just as the scientists catch up with it, information will change.
along those lines, all of you having a relationship with Los Angeles, do you think we opened too soon? Do you think we let it go we opened up too soon? Yeah, Alondra, how come?
More in the beginning, it was more they were saying like, can you please stay home? It wasn't like, stay home. I feel like if we would have taken action earlier, a lot of these things wouldn't have increased. People probably would have been able already to start opening shops. And then, yeah, it was more like of an ask instead of like a mandate. I know other cities and other states were like, you have to be in home or you'll get fined, but that wasn't the case here.
But then again, we opened up again. So what do you think about that, River? You know, we did our safer at home and then we went into the do you think we should have stayed more cautious?
Oh, 100%. And I think one of the biggest things was there was just so much pressure on Gavin Newsom and Eric Garcetti, where even though they are advocating for staying home and being safe, at the same time, they have that fear in their mind of Gavin Newsom wants to be reelected and all these people want to go work their jobs. So when there's high rates of unemployment, the solution is just to open up. Or Eric Garcetti, he's going to want to go and do something else with his career after being the mayor. So I think a lot of it was just trying to appeal to those audiences of people who are upset about the shutdown. And I think really staying completely shut down for a couple of weeks would have been ideal. And we even saw it working in New Zealand. Jacinda Ardern, who's the Prime Minister of New Zealand, has been praised as one of the best world leaders to take an approach to COVID, because basically what they did was they declared martial law, completely shut down COVID. And if you were seen leaving your house for like a 2-week period, 3-week period, you would have been arrested and just been like, okay, yeah, you can't go back out. We're going to make sure to keep an eye on you. And because they shut everything down, they have literally no cases in the entire country. So I think having just shut down, not just California, not just LA, but had we tried to implement something similar on the entire scale of the US, that would have been one of the best approaches to combating COVID, as opposed to just saying socially distance and we'll be fine.
All right, to play devil's advocate on that one, would that have ever worked here in the United States? All right, okay, Richard?
Well, I think for one reason, I mean, there's a couple of reasons why I think it's just not a fair comparison, because New Zealand's an island country. Their urban areas are way less densely populated than ours, and their biggest city is Auckland, which has about 1.5 million people. And the population density, if I'm not mistaken, is like less than half that of New York City. So I don't think you can really compare the two in that way. And also, I think that one of the other things that we're seeing is that with New Zealand, they had, like you said, completely declared martial law and shut down the country. I don't think that's something that Americans should have accepted. I don't think it would be necessary. I think there were a lot of things that we could have done earlier on, like wearing masks. I mean, you see the infection rates in places like Japan or South Korea. Yeah, there's a slight uptick as they reopen their countries, but they really didn't have as stringent of lockdowns as we did either. And I think a lot of that is because culturally, they would wear masks a lot of times, even if the pollution was bad. So they had them at the ready. So rolling it out might have been tougher, but there were all kinds of things that we could have done that wouldn't have been nearly as strict and wouldn't have required so many Americans to lose their jobs or to temporarily be required to stop earning income. I just think it's very easy to say, you know, your business is non-essential, when in reality, if a family owns a small business, regardless of what it is, a restaurant or whatever, that business is essential for them, for their livelihood. So, you know, it's easy if you're not personally affected by that to say that, but we really have to be taking into account whether or not it's just to single out a certain segment of the population and say, yep, tough luck.
Right, right. Well, somebody's obviously working around your place, because We do hear a little construction, the wonder of Zoom. I have to love it. Why are masks political? Why do you think masks became a political issue in this country? Because it's not just, you know, shutting down a business, but now masks somehow have taken on a completely different conceit. They're now political. Why do you think that, Bridget? Why do you think they became political?
Honestly, in my opinion, I think it was due to a lot of misinformation in the beginning, and like even misinformation now, like people worried about carbon dioxide toxicity, like if that's like so prominent just by wearing a mask. And I think it became very political when our president started denying the fact that masks work.
All right, let's go ahead and talk about that carbon dioxide in a mask.
That's a myth. That's not factual in any way. If that were true, healthcare workers would be gone a long time ago, because masks are not new to us. We wear them for lots of different patients that might make us sick. So no, that's not going to happen to you when you wear a mask. So, and if you think about it, healthcare workers or doctors and nurses that work in an operating room, you know, we wear a different kind of mask, which is the N95, and it's really tight on your face, and we're fine. So no.
How long can you wear a mask without suffering any kind of, obviously we talked about the fact that some people are a little bit claustrophobic, but that aside, physically.
You can wear your mask all day. I have worn one for hours. And I'm fine. Your mask is okay as long as it's not wet or torn. It's protecting you, so it's okay.
Right. Yeah. And how good are you? Oh, River.
I just had a quick question about the N95 mask.
Okay.
So there were a recent study that kind of concluded if you have COVID, the N95 mask, or if you're trying not to spread COVID, the N95 mask is problematic because of the holes in the front, which are there to filter. If you're breathing in, it can actually still spread COVID. So do you recommend that the common citizen wears an N95 or something more like a surgical mask?
There are different kinds of N95 masks out there, and there are masks that have the vent and the filter on those. We see a lot of painters wear those. There's other industries that use N95s in addition to healthcare workers. The masks that we recommend our healthcare workers to wear are the N95 without the vent. You know, it's just the plain one that you'll see. There's different versions. There's like a duckbill. There's, you know, and it all depends. You actually have to do a fit test, and that's where we test to see if this mask is right for you. And there's a machine that puts, and it'll tell you if there's leakage, because so that they're actually fit to the person. So those are kind of like a big deal, and we don't, and in fact, I had a delivery of them for my staff that had the vents. I'm like, let's return those and get the right ones. So for your average person, because to be really frank, there aren't enough N95s, nurses and doctors, people in hospitals, x-ray technicians, they're still reusing them. So they're not enough, and really the best practice is at the end of your shift, you throw it away. Or if you're going between a patient that has an infection and one that does not, you change your mask, because the front of your mask is dirty. So we really don't have the luxury of giving those to everyone. Plus they would need to be fit tested to work properly. If everyone wore a face covering, the amount of droplets spread among people would just go down to nothing. So it's really simple, and it doesn't need to be fancy. You know, just cover your face.
But to River's point, the ones that have the filter in the front, those are to actually filter air coming in, but
Right.
it still allows droplets to go
Yes.
out. So we
Yes.
shouldn't be wearing those at
No.
all for any reason, because the whole point here is to keep everything to ourselves.
You're correct, absolutely.
Okay. All right. So you were correct, River. You read that correctly. One of the things that I wanted to ask Alondra is, because your mom is somebody who's very important to you, and she's been, you know, how do you guys talk about this at home? How do you guys talk about this when it comes to what your future looks like?
She just helps me to not stress that much about my job. But for me, it's more like I just want to advance my career and keep going up. It's kind of because for me, I'm always moving. I always find something to do, and when I'm not, that's when I feel like I'm doing something wrong. And so she's telling me to, if I want to, not work, but I can't do that. I don't know. But she also works at a school. And so the good thing, she's not like one-on-one with students as how I will be. And so it's just, we take our own precautions. We talk a lot. We have a little bag. We call it our COVID kit. We have our wipes, gloves, everything. When we go out, we take it. So it's really good. We have, we try to listen to the news, like of precautions to take. We don't just, we kind of we just try to do our best to stay safe.
Because one of the reasons I ask you that is, there's also obviously the physical part of this, but there's also that whole mental health thing that you have all talked about, the stress of what it is that you're doing, what your future's going to look like. So what are you guys doing for your own mental health? What are you doing to sort of stay at peace, to feel optimistic, to feel positive? What are your little mental health breaks? I'm going to ask Richard first.
Yeah, so I think the kind of art that you consume has a big impact on your mood and your overall mental state. So try reading good books, watching good TV. Art is kind of like your diet, right? Like you can have a little bit of candy every once in a while, but that shouldn't be the main, amount of the food that you're consuming. In the same way, watching kind of garbage TV every once in a while is fine. But I've been trying to also not read just the news constantly, because that is not great. Read as much as you need to get your daily, okay, here's what's going on. Don't let it fester. Don't spend too much time in the comment section. It just it's not great, and you're not going to learn much by doing it. So
very cool. Chris, yeah. What's your little mental health break to make sure that Chris is good?
A mental health break, I'd probably say reading. I read a lot. I'd probably say, besides that, really reading, listening to music, watching TV. I've also been trying to mentor little kids, have little meetings with them that are in middle school, and talk to them and try to make sure they're okay. Because I feel like a lot of times, a lot of people right now don't have books and don't have that kind of outreach, and a lot of technology is very okay, I can't get to it. So having someone even just talk to you on the phone if you can, trying to brighten up your day is also some way you can help. So I always try to help other people too.
That's amazing. River, what's your little mental health break?
I mean, I do give into that garbage TV every now and then, but I've been getting into rock climbing over the last year.
Oh.
So one of the things that I do just to keep my sanity is I've been just training as much as I can, whether it's going out and actually climbing on big boulders, or whether it's something where I'm doing push-ups and pull-ups while watching TV to try and get more fit. Just because it's well, we're stuck at home, I might as well be productive with that time.
Mm-hmm.
So that's one of the biggest ways I've been trying to prioritize this quarantine.
Bridget?
Talking to family. I have family in Idaho that I talk to a lot, and I paint and listen to music, and spend time with my family, because my dad is an essential worker, works at a grocery store. So it's we have this ritual where we disinfect them before it comes into the house. So that's kind of been it's kind of weird to call that a distressor, but it's just it gives you peace of mind knowing that my dad is going to be okay and that we're going to be okay. I don't know. It's just, that's the only way I can describe it.
Right. Yeah. Alondra, we talked a little bit about your mom, but what is your personal distressor?
Going out for a run. And I challenge those who say they can't go to the store with a mask, because I can run 2 miles in a mask. So that's what I typically like to do. I also numb my brain by watching TV. I do talk also to a therapist, so it's always helpful.
River.
So in the US, we say that social distancing is 6 feet, but throughout the world, different countries have their different metric of what is considered social distancing. So while it's important to stay 6 feet apart in public, what would you, from a health perspective, say is the absolute minimum we should stay away from people we're not currently living with?
6 feet. There are studies that when you talk, it goes about 3 to 4 feet. So you give yourself some leeway. And then if somebody sneezes, that can go up to about 25 feet. So I was walking in the grocery store and this man had no mask and sneezed, and I just did an about face and went like 3 aisles down. You know, I had a mask on, I'm like, oh no. So yeah, 6 feet minimum.
Richard?
Yeah. So would you say masks, especially inside, is probably the best way to reduce the disease from spreading further?
Yes, the face coverings and keep that social distancing, because you're double covered then. You're covering your face so that droplets can't get out, but then you're also keeping that distance just in case a couple do get out. So you're double covered. So the two together. And then not touching your face, wash your hands. Anytime, when you get home and you're out in the world, first thing you should do is wash your hands. Wash your hands, then take off your mask away from your face.
Alondra?
I had one more question.
Sure.
Do you think it's safe to be in a classroom, or should there be a limit to the amount of students in a classroom at a time, or is that even safe at all because it's in a room for hours?
Yeah, I think, oh my gosh, this is so much debate right now, and especially on the national stage, that I think you would have to look at the size of the classroom, keep the students 6 feet away. And I think, and I challenge you, those of you who are young, to say, what would you do? What would you do? How would you do it differently? Like, we're in Southern California, maybe you move classrooms outside with a tent. There you go. And keep people far apart. And instead of like in high school, how you go from room to room, you go from your science teacher to your math teacher. Maybe you just have a cohort or a group of students that stay together. So those are the only people you hang out with. And then have the teacher come to you. Now your science teacher comes and your math teacher. So I think, it's very challenging times, and I think this is going to be with us for a while, and I think we have to look at how we do things differently. Can we still do some of the things? Yes, but we're going to do them differently.
Bridget?
What would you say to maybe students in Florida who have already been mandated to go back to school in August? Is there any extra precautions that they could take to give them more peace of mind or just trust?
Yeah, wear your face coverings. Don't go get close to people. Wear gloves if that makes you feel better. Don't touch your eyes, your nose, your face. Just be really, really aware of what you're doing every day and what you're touching, it's hard because you're thinking about doing something and not necessarily that, but you sort of have to learn a new set of skills. I touch this, oops, don't touch my face, my hands are dirty, don't touch anything until I can wash them or get some hand sanitizer. What would you do if you were told to go back to school, or if you were empowered to make school look different and make it safe? What would you do?
Raise your hand if you have an answer, a thought. All right, River, what would you do?
I think one of the best ways to do it is to do put a curriculum partially online, partially in schools. So meaning that for, say, 2 days out of the week, you're going and doing classes in person. And then the other couple of days, you're doing it through Zoom or doing homework from home. And even when you are going back to school, on 2 of those days, you're with half the student body. So say upperclassmen would be together. And then on the other 2 days, you would have the lowerclassmen attending the in-person classes with the other students at home. That's one of the ways I think could work. Then there's also the way we've been doing it currently, but I think that's somewhat problematic.
Mm-hmm. Do you have any ideas, Alondra?
The only concern of mine is, for example, college students, they are the least affected. If they go, let's say they're in the dorms, right? They're probably going to hang out with their friends, whether we think they are, they aren't. They don't have that fear as much as the older people, yet they're going to go to the classrooms. And then who are going to be the people that are cleaning those up? It's going to be minorities, people low income, cleaning up the desks, cleaning up everything, sanitizing them. The people who are going to get more affected are those people. And so for me, I'm having a hard time, because I do recognize that in class, learning is better than online, but you're also risking the lives of not just the students, because you can't control where they're going at all times, and the people who clean up after them, and just and even the staff there. I don't know, just for me, it's just kind of like, I don't think it's even safe yet to like be out there, because it's going to be in a month. School's going to start around like a month, so I don't think the statistics are there, in my opinion. I prefer online, but I do really acknowledge the disadvantage that many students will have because it is online. It's like tricky.
Yeah, it's very complicated. Absolutely. Bridget, did you have an idea?
My high school was independent studies, which is the student goes in once a week to get assigned homework and to turn in homework. And I feel like if more schools would even consider adopting like that kind of school, like even just for this year or semester, just to like test the waters, I think it would help like even like the staff have more like trust in the system, if that makes sense. Like for someone that works at a school, or like the staff, like touching on like what Alondra said, like giving them more of a sense of like, you're protected and we care about you, and we want a new system that can help you.
And I'm going to wrap this up with you, Joanne. How important is the element of mental health and de-stressing during this? Because stress can also deplete your immune system.
Absolutely. If you're stressed, and there's tons of studies out there that show your immune system will be weakened. So taking care of your mental health and your physical health is really, really important. All of those suggestions you gave are just wonderful. You know, get a hobby, try something new, learn how to sew, start a garden. You know, there's just so many things. You know, my husband's a wonderful gardener. I can everything. You know, and it takes me away from the world of the city of Los Angeles and COVID. I can just do that, and it's productive, and I actually finish something, you know, which is I don't get to do in my job. So you're doing, I think our future's in good hands. So thank you.
Absolutely. And I can't thank you all enough for sharing your personal lives with us and asking these great questions, and just actually being such a great light for all of us. So again, thank you so much for being a part of Protest and Promise, and I think you all represent the best part of Promise. So we'll see you next time, okay?